My name is Abina Bodede, and I'm an internal medicine resident.
I'm Dr. Adrian Singson. I'm the program director of the Southwest Indiana Internal Medicine Residency Program.
My name is Rody Bashar, and I am a PGY1 resident here at Vincennes Good Samaritan Hospital.
I'm Usha Paspaletti, and I'm a second-year internal medicine resident.
So, hey, I'm Dr. Bryce Mack. I am the Director of Inpatient Pediatrics here at Good Samaritan Hospital, but more importantly, I am core faculty for the Internal Medicine Residency Program here at Southwest Indiana.
When I made the choice to move here during my interview season, one of the things I felt during that time was just a sense of like a family-oriented area. And I and my husband decided that this would be a good place for us to start out. And so far, it's met our expectations. You know, the people here are really nice, very welcoming, very supportive. So overall, it's been a good experience.
Working in Vincennes a lot of times feels like coming home after a year. We work closely with our attendings, and my continuity clinic is here. Every Monday I come up here to see my patients and follow up with them and meet new patients. And I would say that the first time I felt like a quote-unquote real doctor was when I became a PCP to many of the patients in Vincennes.
I have a huge passion for taking care of the underserved, and there's so many opportunities here. I've been lucky to start the first LGBT transgender gender affirming care center and resources in Southwest Indiana here at Good Samaritan. It's wonderful. It's a wonderful place to work. People are very friendly and easygoing, and you know it's got a lot more than you think it would for a small town.
So I think the main impact of having a residency program here, the very first one is just volume. You know, as soon as we have a residency program here, we're putting in 20 to 30 new doctors every year. And that right there is going to create an effect. You're going to see a lot more access to care that you wouldn't have seen before. You have patients who would have had to wait months to see a physician who can now come in, and make emergency visits, or can see a physician within a week. I think that that's the biggest impact on the local population.
With the paucity of internists in the southwest region of Indiana, and the fact that many internal medicine physicians who've been in here and have been established here for many years, many of them are starting to retire. So the residency program for internal medicine is really geared towards addressing the primary care shortage in this area, and now represents the bulk of internal medicine care in the southwest region.
Because we work so closely with our attendings and all of the other specialists, there have been a lot of opportunities for research to pop up. We have a breadth of pathology in this area. There are quite a bit of chronic health conditions, and a lot of times health conditions that haven't gotten proper attention previously. So there has been multiple case reports, there have been research studies, we've been collecting data. I would say probably 50% to 80% of our residents are working with data that we've collected here in Vincennes. So we have opportunities, I think, that many other communities don't have, many other residency programs, simply because of how close-knit our hospital is, how close we are to our attendings, and the pathology we do get to see every day.
Here in Vincennes, I think that there hasn't been a lot of research in the past, mostly due to the nature of it being kind of a community hospital. Now that we have an academic community program here with residents, there's more scholarly activity happening. So the big thing that we're seeing now initially, because we're still a young program, are case reports coming out. So interesting patient cases that normally we might send up to a larger tertiary center, we're taking care of here, mostly because we have that interest from the residents, and I think the attendings are very happy for that as well.
Even though it's a small town, the residency program has kind of brought in the big city scholarship. We have residents who are traveling and attending and being invited as presenters at national conferences. We've had residents who've been published in the British Medical Journal. We've had other publications through Curious and other academic venues?
I was born in Nigeria. I've lived in England. I've lived in Ireland, and then I've lived in several parts of the states here. I come from a small town in Illinois, Morton, so it's not too far from where I and my husband are from. So it was a good transition coming here to Vincent's.
After after work and if you have some downtime, I love walking along the river. And down there's a lot of historic sites that I'll just stop and read the plaques, read the information along the historic sites. And it's funny, every time I'm walking down that way, I run into someone I know. So I love that feeling. I love knowing that I can get to know my town a little bit closer than just staying at work.
Vincennes is a beautiful and very historic town on the Wabash River, the original and first downtown in the state of Indiana. It's, very safe, I would say, quiet, historical, beautiful downtown, and lots of wonderful little boutiques.
The decision to be here was, would I love to be here potentially in the long term? And one of the things that makes the place is the people. And so far, the people here have been very welcoming. My faculty here have been very supportive and very encouraging in my endeavors and just work life. So I would say those are the things that makes, for me, Vincennes a nice place to live. The vibe I get from the people around me.
Vincennes is a place like most, small town America, where I know everyone. At least as an attending that lives here, I can go many places and happen to bump into friends, colleagues. It's an exceptionally safe community. I mean, I can definitely say that because I've lived in a multitude of different towns, including a town of 12,000 people. I've lived in downtown Detroit, Metro Detroit, Kansas City, and Columbia, Missouri. And Vincennes, far and away, has the best sense of community of anywhere that I've ever lived.